tell me about what you're doing now.
Well, we have set up a European colorectal cancer patient organization. After a lot of research, we realized that there was absolutely no colorectal cancer patient organizations in Europe. So we started in our first country, which was Portugal, in 2005, where after 5 years they have now done the most amazing work. They have got a campaign across the whole of Portugal in promoting colorectal cancer. They have started a schools program educating children from a particular age. They did a study as to which age was most receptive and are talking to them about their diet, their lifestyles. They have set up a patient helpline, which is critical. We're now working with them on screening workshops. They have had a pilot, which isn't going anywhere. And across the whole of Portugal, there are groups that are trying to do something. So we're trying to coordinate it all. That's one country. We're now in 16 countries. Different countries work at different levels. Different countries have different issues. Different countries have their cultures. So we try to adapt to the cultures and try and promote the awareness of colorectal cancer, prioritizing colorectal cancer, screening, and national cancer plans.
Okay. So you're helping patients to help themselves rather than knocking on the door in Brussels and doing the advocacy thing.
Right. We do a bit of both, really. Lobbying in Brussels is incredibly complicated, no matter what anybody says. It's not what you know, it's who you know and which doors you can push open. So what we try to do is to lobby the MEPs from the countries where we have our groups and bring them together. And then we get our groups to work with their MEPs to actually make some progress. It's almost a pincer movement. You know, we're all moving in slowly from different directions. You then have groups like the European Cancer Patient Coalition that do the real hard work of pushing from the top end.
So just tell me what is the sort of structure of the Europacolon? Is it sort of syndicated or is it, how is it?
No, basically we have an HQ made up of 5 directors. We have a patient on board, and there's myself and 3 other colleagues with whom I've worked for a long time. And in the beginning, we had to go knocking on doors and persuading clinicians that it was a good idea to help us set up patient organizations, because in certain countries there was a huge threat. Sadly, in some countries, they don't want well-informed, educated patients.
Sure.
And so you had to push the door very, very hard to be able to actually get some response. In other countries, they've come to us and said, help us set up a patient organizations. You've done such fantastic work across Europe. So technically, we've now got groups in most of Europe. We've got a few more to do in the Balkans and the Baltics, and then every country will have a dedicated colorectal cancer patient organization. But I do have to add here, we work with the patients in order to help populations. Sure. Because who can speak the most eloquently, the most passionately, and in the most committed way about the disease is a patient. And so these people are willing to give up some of their life and time to help us move the whole organization forward in their country.
Okay. How do you communicate with each other? On a national basis or European
we
basis? Which language do you use?
Well, English has to be the basic language, but I speak French and Italian and Polish, so we sort of make do. The idea is that we meet once a year. We have an affiliates meeting, and we usually meet in Barcelona because there is a big oncology meeting there, and we are given, medical director, Professor Van Katsem, gives us free space. So we can actually hold our meeting there. And at that meeting, we give them the opportunity to tell us what went well, what didn't go well, and how we can help and how they can help each other, because they learn from each other. It's no use my saying do it that way. When something's actually happened and they've had to fight that challenge, they can talk about it very eloquently to their colleagues. And there's a huge bonding session. They all really enjoy being together. And we then have a debate on these challenges. And usually we have 2 or 3 speakers who talk about key and important things. And next year we plan to amalgamate it with the first colorectal cancer patient meeting. We plan to hold this in Lisbon on the weekend of the 25th, 6th of March. And it's the first opportunity for colorectal cancer patients to come to a meeting where they can learn, where they can debate, ask questions. They have helped us formulate the workshops, so they have an interest in them. And it's challenging, it's exciting. We have no idea how many patients will arrive. Unfortunately, we haven't, at this moment in time, raised enough money to be able to pay for everybody's travel. But what we are doing is we're going to be producing 20 bursaries to help those people who would never have been able to come to be able to come to the meeting.
Good. So, and is this a patient-only meeting? The doctors keep out, or how's it?
No, it's. We'd like to see nurses and doctors there as well, not just as speakers but as participants, because I think it's very important for them to also understand what their groups are doing and what the patients are doing. And I'm hoping that we'll also get patients from countries where we still haven't got a group. The aim of the meeting, personally for me, would be to inspire and put the passion into people that when they leave, they say, we've got to go back and do something about this. We want to have screening. We want to have non-invasive surgery. We want access to the best treatments. And if we haven't got them, we're going to do something about it.
Sounds like Lisbon's going to be fun.
Lisbon's going to be busy and challenging. But I think it's the right time. Europacolon has now been going for 5 years. Our biggest challenge was to get credibility in the clinical community, and that has now happened.
Good.
We're beginning to be known in Brussels. Our groups are getting recognition within their own countries. So the time's right.
Good. Congratulations.
Thank you.
You've come a long way.